Today I will be talking about a very important part of our life. 1/3 of our lives are spent on sleeping and naps. Some needs more, some needs less, but undoubtedly everyone needs several hours of it. But what happens if we don't get well rested? This you will find out in this video. Not getting enough sleep drains your mental abilities and puts your physical health at risk. Missing the recommended 7 to 9 hours of sleep does more than make you feel dizzy and grumpy. The long-term effects of sleep deprivation are valid and dangerous. Your central nervous system is the main information highway of your body. Sleep is necessary to keep it functioning properly, but chronic insomnia can disrupt how your body usually sends and processes its information. Sleep deprivation leaves your brain exhausted, so it cannot perform its duties as well. You may also find it more difficult to concentrate or learn new things. The signals your body sends may also be delayed, decreasing your coordination and increasing your risk for accidents. Sleep deprivation also negatively affects your mental abilities and emotional state. You may feel more impatient or prone to mood swings. It can also compromise decision-making processes and creativity. If sleep deprivation continues long enough, you could start hallucinating. A lack of sleep can also trigger mania in people who have bipolar mood disorder. Other psychological risks include such as impulsive behavior, anxiety, depression, paranoia, suicidal thoughts. You may also end up experiencing microsleep during the day. During these episodes, you will fall asleep for a few to several seconds without realizing it. Microsleep is out of your control and can be extremely dangerous if you are driving. It can also make you more prone to injury if you operate heavy machinery at work and have a microsleep episode. While you sleep, your immune system produces antibodies and cytokines. It uses these substances to combat bacteria and viruses. Certain cytokines also help you to sleep, giving your immune system more efficiency to defend your body against illness. Sleep deprivation prevents your immune system from building up its forces. If you do not get enough sleep, your body may not be able to fight against invaders, and it may also take you longer to recover from illness. Long-term also increases your risk for chronic conditions, such as diabetes, mellitus, and heart disease. The relationship between sleep and the respiratory system goes both ways. A nighttime breathing disorder called obstructive sleep apnea can interrupt your sleep and lower sleep quality. As you wake up throughout the night, this can cause sleep deprivation, which leaves you more vulnerable to respiratory infections like the common cold and flu. Sleep deprivation can also make existing respiratory diseases worse, such as chronic lung illness. Along with eating too much and not exercising, sleep deprivation is another risk factor for becoming overweight and obese. Sleep affects the levels of two hormones, leptin and ghrelin, which control feelings of hunger and fullness. Leptin tells your brain that you have had enough to eat. Without enough sleep, your brain reduces leptin and raises ghrelin, which is an appetite stimulant. The flux of these hormones could explain nighttime snacking or why someone may overeat later in the night. A lack of sleep can also make you feel too tired to exercise. Over time, reduced physical activity can make you gain weight because you are not burning enough calories and not building muscle mass. Also causes your body to release less insulin after you eat. Insulin helps to reduce your blood sugar level. Also lowers the body's tolerance for glucose and is associated with insulin resistance. These disruptions can lead to diabetes mellitus and obesity. Sleep affects processes that keep your heart and blood vessels healthy. Hormone production is dependent on your sleep. For testosterone production, you need at least 3 hours of uninterrupted sleep, which is about the time of your first REM episode. Waking up throughout the night could affect hormone production. This interruption can also affect growth hormone production, especially in children and teens. These hormones help the body build muscle mass and repair cells and tissues, in addition to other growth functions. The pituitary gland releases growth hormone throughout each day, but adequate sleep and exercise also help the release of this hormone. The most basic form of sleep deprivation treatment is getting an adequate amount of sleep, typically 7 to 9 hours each night. This is often easier said than done, especially if you have been deprived of precious shutai for several weeks or longer. After this point, you may need help from your doctor or a sleep specialist who, if needed, can diagnose and treat a possible sleep disorder. The following are some of the most common types of sleep disorders: obstructive sleep apnea, narcolepsy, restless leg syndrome, insomnia, circadian rhythm disorders. If you are diagnosed with a sleep disorder, you may be given medication or a device to keep your airway open at night to help combat the disorder so you can get a better night's sleep on a regular basis. How can insomnia affect you? Temporary insomnia may increase your fatigue and perceived stress levels. Persistent sleep deprivation may lead to memory and learning challenges, emotional distress, increased production of stress hormones, irritability and other mood changes, decreased productivity, difficulty with focus and concentration, worsening of existing symptoms of mental or physical health, increased blood pressure. In the long term, a chronic lack of sleep can have a negative effect on your heart health and metabolism. Research shows long-term insomnia may be associated with a higher chance of obesity, type 2 diabetes, hypertension, and some cancers. Lack of sleep may lead to cognitive challenges. Insomnia may impact attention, working memory, decision-making processes, learning ability. The 5 stages of sleep deprivation refer to the amount of time you go through without sleeping. After each stage, additional negative side effects begin to occur. Missing 24 hours of sleep won't cause major health problems, but you can expect to feel tired, exhausted, or off. Staying awake for 24 hours may increase your risk of errors and accidents in everyday tasks. When you miss 36 hours of sleep, you'll have an overwhelming urge to sleep. This is called sleep pressure. Along with the effects experienced from 24 hours of sleep deprivation, you may experience increased appetite and extreme fatigue. You may also start to have microsleeps without realizing it. Missing sleep for 48 hours is known as extreme sleep deprivation. At this point, it'll be even harder to stay awake. Other possible effects may include depersonalization, anxiety, perceptual distortions, increased irritability, temporal disorientation. After 3 days of sleep loss, your urge to sleep will strengthen and possibly become uncontrollable. You may experience more frequent, longer microsleeps. Sleep deprivation will significantly impair your perception. Your hallucinations might become more complex. You may also have delusions, disordered thinking. Awake for 96 hours or more, your perception of reality may be severely distorted, resembling acute psychosis. Your urge for sleep will also feel unbearable. According to the 2 studies, some sleep, mental, and physical conditions may be associated with hypersomnia, including narcolepsy, obstructive sleep apnea, restless leg syndrome, depression, bipolar disorder, chronic fatigue syndrome. Having a circadian rhythm disorder may also lead to excess daytime fatigue, which might cause falling asleep when you sit down. CRDs are often caused by changes that affect your daily routine, such as traveling often or alternating between working day shifts and night shifts. Sleeping attacks are associated with a sleeping condition called narcolepsy, a chronic neurological condition that affects the nervous system. Narcolepsy is characterized by excessive daytime fatigue, lethargy, and a strong urge to sleep. These feelings often come on suddenly in episodes that may last up to a few minutes. Some people experience sleeping attacks from time to time, while others may experience multiple daily. These attacks are more likely to occur when you sit down, but they can also happen when you are performing tasks like walking, gardening, and driving. For instance, drinking too much alcohol could lead to someone passing out or falling asleep. So as you see, we all could face serious consequences by missing our well-needed sleeping hours. Therefore, please always try to find a way to get well rested and getting ready for the next day. In my next video, I will explain how to fight against lack of sleeping. As for now, I say thank you for watching. Please subscribe, and if you like the video, hit the like button.